Now, News 2 at 10.
Dispelling fears and rebuilding trust. Today, a plan from the state about how to combat vaccine hesitancy. Welcome to News 2 at 10. I'm Bob Mueller.
And I'm Haley Wilgus. As the state starts to loosen COVID-19 restrictions, it's also urging those hesitant about getting the vaccine to reconsider. Demand for doses has slowed down a lot over the last couple of weeks here in Tennessee. So today, the Department of Health addressed its plans to market the vaccine for those who are skeptical. But News 2's Brooke Reese explains why health officials say the state is still ahead of schedule.
The reason our vaccination rates are lower is because people aren't demanding it.
For Tennessee, it's no longer an issue of supply, as 34.4% of people across the state have at least one dose in the fight against COVID-19.
Right now, we are able to fulfill any of the orders that any of our providers have made because the ordering, quite frankly, is lower than the maximum supply.
Today, State Department of Health Commissioner Dr. Lisa Piercy said things are slowing down on the flip side.
Last week, there was less than 20% of the total allocation requested from providers. And while that is disturbing, that is just a reflection of low demand.
Piercy says the primary focus to fix that is addressing why people are hesitant to get their first dose.
There were a fair number of people who were more afraid of dying from the vaccine than they were dying from COVID itself.
Piercy says market research showed state health officials that fear, mistrust, and data are keeping certain populations from rolling up their sleeves.
When you start dropping under the 60-year-old population and certainly below the 50-year-old population, you see pretty quickly declining percentages in these age brackets.
But the state is still ahead of schedule in terms of timing.
We thought the full availability of vaccine wouldn't be until mid to late summer. And so we were fortunately able to accelerate that on a much quicker timeline. And so we therefore also accelerated our media efforts.
In the hopes that those with questions or concerns about the vaccine can reconsider their perspective to reach herd immunity across the state. Brooke Reese, News 2.
Dr. Piercy says the Department of Health will start a digital campaign by the end of the week and will continue to promote vaccine distribution throughout the month of May. Meanwhile, the virus itself isn't slowing down. Just less than 8% of tests taken over the past 24 hours have come back positive. Just today, more than 1,100 new COVID-19 cases reported, along with 11 new deaths.